Joining us now is Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases at NIH. Dr. Fauci, good morning.
Good morning, Savannah.
We'll talk about the hospital situation in just a moment, but let's start with the vaccines. I know they're all equally near and dear to you, but the NIH oversaw the trial for the Moderna vaccine. It's now been approved overwhelmingly. How soon do you think we'll see shots in the arm?
I would anticipate, Savannah, that we likely will see shots in the arm by the very early part of next week. I would hope Monday or Tuesday, but, we'll just have to wait to see for the final decision. But very soon, literally within a few days.
One of the things we learned in this hearing is that Moderna's vaccine apparently not only prevents disease, but also prevents infection. Now, first of all, what is the distinction between those two things? I kind of thought all vaccines did that. But the distinction, but also why is it important? Why would that be significant?
Well, when you protect against clinical disease, that's the primary endpoint of the vaccine trial, namely prevents you from not only getting infected, but from having symptomatic disease. You could theoretically and in reality get infected, but be protected against actually any clinical manifestations. So if you protect against clinical disease, that's very good. But if you also even prevent a person from getting actually infected, that would mean that you're preventing someone from passing the infection on to someone else. And that kind of interferes with the chain of transmission.
That seems
so the
hugely
optimal
significant.
Thing would be,
Yeah.
Yeah, well, yes, that is. What we need to know as we go through maybe more months of following up is just to what the extent of that is. You would like optimally to not only prevent against disease, but to prevent against infection. That's the ultimate goal.
This is one of those times when we need to flood the battlefield. We need as many vaccines out there as we can possibly get. Just realistically, when you survey the scene, you know what's coming down the pike. How many vaccines ultimately do you think are headed toward approval? How many more might we get and when?
Well, in the United States, we've made investments in 6 candidates. 5 of them now have either completed phase 3 clinical trial or are well into phase 3 clinical trial. The reason of which I think you mentioned correctly, you want to get as many out there as possible because you want enough doses to vaccinate everybody in the country and even to make a contribution to the global effort to contain this virus by getting companies to make investments so that not only the United States but the rest of the world. That's just us, 6 candidates. You have China, you have Russia, you have the UK. They are all making vaccines, which is very, very good. There's no competition here, Savannah. We want as many successful candidates as we possibly can.
We had Secretary Azar on the show on Monday, and he said that he thought some vaccine would be available widely to the general public as early as late February or March. Do you agree with that timeline?
The answer is, in many respects, yes. I have been saying end of March, beginning of April. It really is going to depend on how successfully and effectively we roll out the higher priorities. Because, as you know, the Advisory Committee on Immunization Practices with the CDC has put together a priority list. Once you get through the priority list, then you could say it's sort of open season for anyone who is not necessarily on a priority list, like the normal man and woman in the street who has no underlying condition. That likely will be somewhere Marchish. I said March, April, February, March. It's going to be a close call on that.
The vaccine is the bright spot. Everything else, honestly, seems very, very dark. We just saw what happened in California. They're ordering 5,000 extra body bags. Some hospitals are having to put patients in parking lots because of they're reaching their capacity. I feel like you and I have been talking about this Armageddon moment for the healthcare system for months. Are we there?
It's a tough situation, Savannah. I mean, we're sitting here talking about vaccines, which is such a positive thing. But all of this is sort of bittersweet because at the same time as we're moving ahead with what will ultimately be the answer and the final solution to this, we're living through very, very difficult times. I mean, if you look at the number of new infections between 200,000 and 300,000, the other day we had 3,565 deaths in one day. So we still are in a serious situation, which tells us that as we are proceeding with the rollout of the vaccine, we absolutely have to adhere to the public health measures that we're talking about all the time, the wearing of masks, the physical distancing, the avoiding crowds in congregate settings. We can't just say, well, there's vaccine on the horizon, so let's just forget about everything else. We're in a difficult situation, so we've got to do both. We've got to proceed with the rollout of the vaccine, but we've got to make sure we stay with the public health measures.
Vice President Pence is going to be vaccinated a little later this morning. Speaker Pelosi, Senator Mitch McConnell are going to get the vaccine, which raises the question, when might you get the vaccine? I know a lot of folks will feel better if they see you do it.
I'm ready to go, Savannah. We're waiting for the supply to come in to the NIH. We haven't got our supply yet. I hope it's coming in the next couple of days. If it does, I'm going to get vaccinated as soon as I can. I hope that's going to be within the next few days to the early part of next week.
Well, forgive me, you're turning 80 on Christmas Eve, so maybe that will be your birthday present. Dr. Fauci, happy birthday, Merry Christmas. Thanks for being with us.
Thank you, Savannah. Good to be with you.